This is Dr. Robert Bates at Leominster Chiropractic Spine and Injury Center. Today we're going to discuss whiplash, and more specifically a rear end, or what is called an acceleration deceleration injury to the cervical spine. I'm going to go over the mechanics of injury and the tissues that are injured, and when I'm done with this presentation you will have a very good understanding of what happens when you are rear-ended in a vehicle and all of the different prognostic factors that come into play, and if are present, make it a much more serious injury. So we're going to use a couple of different photographs and a couple of different graphs that we have put together, and I will explain them as we go along. Let's discuss for a moment how serious a problem this really is in the United States. There are about 3 million Americans that are involved or injured in rear impact collisions every year in the United States. The risk of injury from a low-speed rear impact crash is somewhere between 35% to 68%. About 10% of those injured become permanently disabled because of the trauma. Minor neck injuries account for up to about 60% of all permanent impairment claims. So for every 6 million occupants in a low-speed rear-end impact collision, about 3 million will be injured, about 1.5 million will have chronic pain, and about 300,000 will become disabled because of the pain. That means that about 10% of the population walking around in the United States has neck pain from a car accident.
We divide this type of rear-end collision into 4 separate parts simply to simplify the explanations. The entire time sequence is about 600 milliseconds, or 6/10 of 1 second. In this first phase, when the car is first struck from behind, the car starts to move forward after the compressibility of the materials of the car, or the crushing of the car, occurs. As the car starts to move forward, it ramps down, which elevates you relatively in your seat, since the seat goes down. You have your foot come off of the brake, which allows a greater acceleration and more damage in this rear end impact. You then begin to straighten out the curves in your back because of compression into the seat. In the second phase of this accident, we see vertical motion of the torso and straightening of the spine, which can actually cause a vertical rise of about 3.5 inches. This creates a compression in the spine and all the way into the brain. The head snaps into full extension, and since you have risen up in the seat, very often the head will go over the head restraint and collapse it, creating a fulcrum that damages your neck even further. The jaw joint or temporomandibular joint is often injured in this particular sequence. In the third phase of the accident, the head begins its forward motion and the torso descends in the seat. We have the foot coming back down and your body coming back down in the seat. Because of the compressibility of the seat, we have springing off of the seat now, and the slack is taken out of the shoulder harness, which stabilizes the shoulder and causes even more damage in the neck as the head and neck fly forward. In the fourth phase of this accident, full deceleration of the head, the neck, and the torso is aggravated by the shoulder harness. High tension and shear forces occur in the spine. High brainstem, spinal cord, and nerve root tension occur as the 11-pound head is flying forward, pulling on the neck. There is posterior ligament damage very often in this part of the accident, and this occurs as the vehicle is slowing down, our foot comes back on the brake, which increases the deceleration. If you have been unlucky enough to strike something in front of you, like a second vehicle, this increases the deceleration component and causes much greater injury. It really should be noted here that we not only have excessive ranges of motion, in other words, past the point where ligaments can stretch to, but the bigger problem here is the speed of the head and everything moving. We go past the elastic limit of the ligaments, and even though they very often do not stretch to their full length, they are stretched so fast that they tear when they have not even reached the potential of their full length.
The sequence of events thus far in these 4 phases of whiplash are almost like Murphy's Law. In other words, the wrong things happen at the wrong times, and they come together to create much more damage. For instance, as you are first hit, you tend to have the car move forward, which takes your foot off the brake, which increases the acceleration and forces of the vehicle. You compress into the seat back, straightening your spine. The back of the car ramps down, which relatively puts you higher in the seat, and that lets your head go over the neck rest or headrest, causing more damage. Right when the vehicle begins to slow down is when you are accelerating off of the compressed seat, which further accelerates you, causing more of a deceleration injury. So many of these things happen together, which makes a lot of neck trauma. And in this rear end type collision, it is by far the worst type of neck accident that you can have. So let's look at some of the other things that are involved.
This chart will help us understand the relationship between the car, the torso, and the head in this accident. The left scale rising vertically is the acceleration in g-forces of the various things on the graph. The bottom horizontal line is the time in milliseconds, and you will notice that the entire graph is less than half of a second. And you will see that this is an 8-mile-per-hour impact, which is a very low-speed collision where most of the injuries occur in this country. The change in velocity, or delta V, is 4.9 miles per hour, meaning that the vehicle struck will reach 4.9 miles per hour and then slow down, which again is a very low impact collision. It is interesting to note with this rear end collision, the mechanisms that occur that we have talked about previously cause such a high rate of acceleration in g-forces of almost 5g for the head. You will notice that the green curve representing the car accelerates to about 1.7 Gs and then decelerates. The torso, because it springs off the seat back, reaches over 3 Gs, and the head, because it snaps back off of the headrest and the compressed seat and is restrained often by the shoulder harness, will reach a peak acceleration of almost 5 Gs. This is enough force, even in a low-impact collision, to cause all kinds of damage to the head and neck and brain. There are many risk factors that create a very poor outcome in an automobile accident, and especially in a rear impact collision. Some of the major ones are having your head turned, which causes tremendous increase in damage in the cervical joints. Having had prior injury increases your risk. Having had prior headaches or prior neck pain, meaning that there was already dysfunction in the neck, which causes greater injury with a new injury. Inadequate headrest, and as a matter of fact, if it's more than 2 inches behind your head, it does very little because of the speed that the ligaments are torn at. Having a poor position in the car, having pre-existing arthritis, being an older person or a female, having pre-existing degenerative disc disease or arthritis, wearing the shoulder harness, and also non-failure of the seat back. The worst prognostic factor is usually not being aware that you are going to be struck, simply because you do not tighten up any muscles, and the reflexes for the muscles to react occur after the accident is over, since it all happens in a half of a second. So you get much more ligament damage in this type of accident. This slide represents sources of referred pain from damage to the cervical spine in a rear impact collision. Essentially, there can be any tissue damaged in the cervical spine, but it is interesting to note that some of the tissues in the cervical spine are not pain sensitive, so there can be damage, and unless there is a very large buildup of inflammation, there may be very little pain, but there will be tremendous arthritic change over the years because of the damage. For instance, there are 9 ligaments that attach bone to bone through the cervical spine, but only 3 of them are pain sensitive. So again, you could have considerable tearing in many ligaments and not have much discomfort. It is interesting to note that there are many common symptoms following whiplash. I will not go through all of them since there are more than 22, but neck pain is seen in 92% of people, headache in 57%, fatigue in 56%. We see shoulder pain, anxiety, pain between the shoulder blades, low back pain, disturbances in sleep, upper limb numbness and tingling, sensitivity to noise or sensitivity to light, an impaired concentration, blurry vision, being more irritable, trouble swallowing, dizziness, forgetfulness, pain in the arms or weakness in the arms, ringing in the ears, and pain in the jaw joint. So we can see that there are a tremendous number of tissues damaged in this type of accident, and a very good evaluation is necessary following this type of trauma. This chart represents actual statistical facts about whiplash injuries. It's interesting to note that most injuries occur at crash speeds below 12 miles per hour. However, most cars withstand an 8 to 12 mile per hour impact without structural damage that is visible because of their shock-absorbing bumpers. More than half of all low-speed rear impact collision injuries occur without vehicle damage. There is no correlation between vehicle damage and outcome. Let me say that again. There is no correlation between vehicle damage and outcome. The peak acceleration of the head is much greater in these accidents than the peak acceleration of the vehicle. A 5 mile per hour delta V crash, meaning that the vehicle that gets struck reaches 5 miles per hour, causes about 10 to 12 g-forces of acceleration to the occupant's head. Now, what is the actual threshold of damage for a healthy adult? The threshold is shown to be about 5 miles per hour in a real world occupant. However, 60% of injuries occur at 6 to 12 miles per hour, more than half, where there is no visible damage to the vehicle. Only about 18% of injuries occur under 6 miles per hour, and only about 22% of injuries occur over 12 miles per hour. So you therefore have more than half of the injured occupants in a vehicle that was struck between 6 and 12 miles per hour, showing almost no damage to many of these vehicles, but lifelong problems to the occupants. This chart represents the actual numbers of people that are involved with these types of problems. In the United States, there's well over 6 million crashes per year, and about half of the people are uninjured. About 25% of the people are injured but recover, and about 20% develop chronic pain. About 5% of people, or 10% of those that are injured, actually become disabled from the trauma. That means that if there are 6 million crashes, 3 million people are uninjured, and of the 3 million that are injured, 1.5 million of them will recover. About 1.2 million will develop chronic pain, and about 300,000 will become disabled. If you do the math, then over the last several decades, we have ended up with approximately 9 to 10% of the adult population walking around in the United States with chronic neck pain due to these traumas. This is an X-ray of a typical example of what happens years following cervical trauma from an automobile accident. The X-ray on the left shows a lateral view of the cervical spine with one disc degenerated inside the yellow circle. The same patient 17 years later has horrendous arthritic change through their entire cervical spine. And this shows that it takes at least 5 years to start to see degenerative changes which continue to worsen because there are many soft tissues that become abnormal with fixation and scar tissue and chronic muscle spasm.
So what should you do if you have an automobile accident? By far, the best care is chiropractic care by someone who performs various types of physical therapy like red light laser and has a good rehabilitative exercise program. All of the information today would suggest that a very good comprehensive rehabilitative exercise program is necessary following this injury. These injuries actually go through 4 stages, and the first stage lasts from 12 to 72 hours. It is the active swelling phase, and during this phase you want to reduce the inflammation by taking a lot of natural anti-inflammatories like turmeric and ginger and omega-3 oil, the EPA and omega-3 oil. There are several things, boswellia, things that should be taken without any harmful side effects. The second stage is called passive congestion, and it can last from 2 to 4 days. During this phase, we want to start to have a little bit more motion and help to pump fluid out of the area, and also to begin to restore a little bit of motion. There's more and more research that says immobilization should be avoided at all costs. The third stage is called the repair stage, and that can last as much as 6 weeks. This is when your body is forming fibrin or fibrinogen, laying scar tissue down. The thing that people do not realize is that scar tissue is a type 2 collagen. The original tissue is a type 1 collagen. So it is not going to be as elastic and not going to be as strong. So that is why you want to minimize the amount of scar tissue during the first 2 phases. The fourth phase is the remodeling phase, which can last up to 6 months when your body is remodeling and trying to line up the scar tissue so it is a more functional scar. This is when a very good rehab exercise program is necessary. Chiropractic care is the only therapy that can restore motion if there is fixation with hypermobility above or below, because we can be very specific in increasing motion where there is scar tissue. We also can align scar tissue, prevent stiffness, restore flexibility, restore muscle tone and coordination, reduce the risk of re-injury, promote quicker healing, and restore sensation, as well as reduce arthritic change. When you add this manipulation to laser therapy and vibratory plate rehab, such as I have at my office, you get outstanding results with people that otherwise would have suffered much more in the future. So give me a call if you would like to discuss your problem, and we will see what we can do for you. Have a great day.
Please remember that if you have been evaluated at the emergency room, their primary objective is to make sure that you do not have a life-threatening problem. And other than that, they are telling you to follow up with a family doctor or another treatment facility if your symptoms continue. You need to follow up with someone who understands these problems and will bring you through the various phases, performing therapies that will give you the best end result and the most functional cervical spine.